Good evening, Philippines and the world. Today is Wednesday, April 1, 2020. Join us for the next 45 minutes as we deliver today's top stories around the globe. I'm Angelo Castro III.
We are also seen in 1,935 satellite monitoring centers nationwide and live via streaming worldwide through UNTV News and Rescue Facebook account and UNTVweb.com. I am William Theo.
And here are the headlines.
Police arrest 20 Quezon City residents for staging a protest to demand aid amid the COVID-19 crisis. 8 more people died due to COVID-19 in the Philippines as the number of confirmed cases rise to 2,311. The National Bureau of Investigation summons Pasig City Mayor Vico Sotto for supposed violation of the national government's policy on the Luzon-WIDE enhanced community quarantine. The World Health Organization cautions Philippine authorities to consider the country's epidemiological situation before deciding to lift the Luzon-WIDE enhanced community quarantine. The Philippine Ports Authority warns of possible port shutdown in Manila due to congestion of cargoes. And U.S. President Donald Trump warns Americans of very painful weeks ahead in the coronavirus fight.
The Quezon City Police District arrested some 20 Sitio San Roque residents after they staged a protest demanding help amid the enhanced community quarantine being implemented in Luzon. The local government of Quezon City, on the other hand, clarified that the protest rally was staged by a group with vested interests. Here's Asher Cadapan Jr. to tell us why.
Some 20 residents of Quezon City who were among a group that staged a protest to demand food and other aid from the government were arrested on Wednesday. According to the Quezon City Police District or QCPD, the arrested individuals who were residents of Barangay Bagong Pag-asa were apparently part of dozens of protesters who staged a rally in Sitio San Roque along EDSA to appeal for assistance amid the COVID-19 community quarantine. The group complained of not receiving any help from the local government, although some residents in their area have already received food packs distributed by their barangay officials.
Kaya nga nagagalit sila kasi bakit sa gilid lang nabigyan, bakit sa kanilang grupo hindi pa nabigyan? Ibig sabihin na doon lang daw nagtapos yung dala nila Gov't, hindi sila nabalikan ulit.
The Quezon City government, however, denied the claims, stressing that there is continuous distribution of food packs both from the local government and barangays. The city government also said that based on guidelines, all recipients of food packs must be properly documented and the lists are available for scrutiny in the interest of transparency. Nevertheless, the mayor has instructed city personnel to review the list to make sure nobody has been inadvertently left out, the QC government said in a statement. The local government also believes that the rally was instigated by a left-leaning group who allegedly told the residents to go to the area to get their relief packs.
Ay yung mga tao naman po, dahil akala po nila at bigayan po talaga, pagdating ho nila doon, yung mga hardcore na kadamay, yun ang po nagpainit at nag-instigate na wala daw hong ibinigay na relief goods ang ating pong lungsod at ang ating pong barangay. Pero sa katotohanan po, meron na hong binigay ang barangay.
QCPD members who responded to the incident said they tried to urge the residents to go home, but the residents allegedly refused, which prompted authorities to make arrests. Police assured no one was hurt in the incident. The residents are presently detained at the Camp Karingal. The Philippine National Police said the residents will face charges for illegally holding a public assembly and for violating the law on response to notifiable diseases, epidemics, and health events of public concern, Presidential Proclamation Number 922, Bayanihan to Heal as One Act, and the Article 151 of the Revised Penal Code for disobedience to persons in authority. Asher Cadapan Jr., UNTV News and Rescue, Quezon City. We serve the people, we give glory to God.
President Rodrigo Duterte ordered that donated medicines and medical supplies to address the 2019 coronavirus disease or COVID-19 shall be coordinated with and transmitted to the Office of Civil Defense or OCD for consolidation. On March 31, Duterte signed Administrative Order number 27, establishing a framework for the acceptance, management, distribution, and delivery of all medicines, medical equipment, and supplies and other health products donated to the Philippines to address COVID-19. The order does not apply to donations of food items, accommodation, transportation, and other basic necessities. These donations will be allowed without need of consolidation in the OCD. Under the order, the OCD is directed to prepare an inventory of all the donations to the national government and to the DOH that would be consolidated. The Philippine National Police will begin to escort healthcare workers to the hospitals they work in. Meanwhile, the locally produced COVID-19 testing kit will undergo a field test in 5 accredited testing centers in the country this month. Rosalie Cos explains why.
National Police Chief Police General Archie Gamboa directs all local police units to provide assistance and security to medical staff and health workers. PNP personnel who man quarantine control stations are also instructed to assist and escort the medical professionals to their assigned hospitals. This comes after violent attacks on healthcare workers in Cebu and Sultan Kudarat.
Threatening the safety of our health workers in the midst of this crisis is unacceptable, and the PNP is committed to apply the full might of the law against those who dare to harm our health workers. And we'll do whatever it takes to protect them from crime, violence, and any form of oppression and discrimination. Hindi po tayo papayag na galawin ang ating mga bayani.
Meanwhile, the field validation of locally produced COVID-19 testing kits is expected to be finished today. And from April 4 to 25, this will undergo field tests in 5 accredited testing centers in the country, according to the IATF against COVID-19. The Department of Science and Technology has said before they had produced 26,000 test kits for the field implementation and distribution in Philippine General Hospital, Makati Medical Center, the Medical City, Vicente Sotto Memorial Medical Center, Southern Philippines Medical Center, and Baguio General Hospital. This COVID-19 testing kits developed by the University of the Philippines National Institutes of Health and Manila Health Tech Incorporated are seen to increase the country's COVID-19 testing capacity. Rosalie Cos, UNTV, News and Rescue. We serve the people, we give glory to God.
Meanwhile, the World Health Organization Western Pacific Regional Director advises Philippine authorities to make careful considerations about the epidemiological situation in the country before lifting the enhanced community quarantine measure in Luzon. Aiko Miguel details why.
The Luzon-wide enhanced community quarantine is scheduled to be lifted on April 12, 2020 if the Philippine government decides not to extend it. But World Health Organization or WHO Western Pacific Regional Director Takeshi Kasai addressed this issue during a virtual press briefing on Tuesday. Director Kasai emphasized that the government should be precautious when lifting the quarantine, considering the epidemiological situation in the Philippines. The Philippine government should not be complacent, especially that the threat of COVID-19 will not end in just a month or two, as the WHO says.
Obviously, as I mentioned, that these measures cannot continue forever. So at some point, the government needs to think when to lift these measures. When you do that, again, we have to make a careful considerations of the epidemiological situations and the impact of those lockdowns. And we may have to peel one by one, not just immediately lift, but those public health measures, which is bundled at the lockdown, to balance the control diseases and to bring back the societies back to normal.
Director Kazay added that the government should sustain its efforts on contact tracing, early detection of infected individuals, and the implementation of quarantine on persons considered as close contacts of COVID-19 positives.
Government has to ensure the basic lifelines will maintain. So if you don't have those kind of structures, it's very difficult to make those measures. And lockdown, to be effective, we have to also continue find the case, isolate and treat early, and also trace and quarantine those contacts. And lockdown is a bundle of public health measures.
The Philippines Health Department, on the other hand, says it has yet to make a recommendation to the Interagency Task Force for the Management of Emerging Infectious Diseases regarding the lifting of enhanced community quarantine. Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
U.S. President Donald Trump warned Americans of a painful 2 weeks ahead in fighting the coronavirus with a mounting U.S. death toll that could stretch into the hundreds of thousands even with strict social distancing measures. Beverly Saison tells us why.
In perhaps his most somber news conference to date about the pandemic, U.S. President Donald Trump urged the population to heed guidance to limit groups to no more than 10 people, work from home, and not dine in restaurants or bars.
It's absolutely critical for the American people to follow the guidelines for the next 30 days. It's a matter of life and death, frankly. It's a matter of life and death.
White House Coronavirus Coordinator Deborah Birx displayed charts demonstrating data and modeling that showed an enormous jump in deaths to a range of 100,000 to 240,000 people from the virus in the coming months. That figure was predicated on Americans following mitigation efforts. One of Birx's charts showed as many as 2.2 million people were projected to die without such measures, a statistic that prompted Trump to ditch a plan he articulated last week to get the U.S. economy moving again by Easter on April 12th.
We're going to go through a very tough 2 weeks. And then hopefully, as the experts are predicting, as I think a lot of us are predicting after having studied it so hard, you're going to start seeing some real light at the end of the tunnel. But this is going to be a very painful, very, very painful 2 weeks.
Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Diseases, said all efforts were being made to make those numbers lower.
So what we're going to see, and that's we got to brace ourselves, in the next several days to a week or so, we're going to continue to see things go up. We cannot be discouraged by that because the mitigation is actually working and will work.
The federal guidelines, which now are in place through the end of April, include admonitions to avoid discretionary travel, not visiting nursing homes, and practice good hygiene.
That will do this. There's no magic bullet. There's no magic vaccine or therapy. It's just behaviors. Each of our behaviors translating into something that changes the course of this viral pandemic over the next 30 days.
Trump said he planned to remain at the White House for the most part over the next 30 days. He added the White House was looking at a possible travel ban for Brazil. After the White House earlier discouraged Americans from wearing masks if they were not sick, the president encouraged the practice on Tuesday but said people should use scarves so as not to divert supplies from healthcare professionals. Beverly Saison, UNTV News and Rescue, USA. We serve the people. We give glory to God.
And now let's get the latest tally of the coronavirus cases around the world. The COVID-19 pandemic has now reached a total of 862,234 confirmed cases in 180 countries. The fast-spreading disease has also claimed 42,404 lives, with 178,836 recovered patients across the globe. The United States of America now has the most confirmed cases in the world, with a total of 189,633 cases and 4,081 deaths. Italy, meanwhile, still has the most coronavirus-related deaths globally, with 12,428 fatalities and 105,792 confirmed cases. As of April 1st, 2020, Spain has now a total of 95,923 confirmed cases, followed by China with 82,308, Germany with 71,808, and France with 52,837 cases. Meanwhile, the Philippines records 227 new cases today, bringing the total of confirmed cases to 2,311. 8 new deaths were also recorded, bringing the total to 96. Up to date, there are a total of 50 recovered patients in the Philippines. Some lawmakers urge authorities to release the residents of Sitio San Roque in Quezon City after they were arrested this morning for staging a protest. For the Makabayan bloc, lawmakers arresting the citizens is not the solution to their problem. Vincent Arboleda tells us why.
20 residents of Sitio San Roque in Quezon City were arrested earlier after staging a protest against the government for help. According to ACT Teachers Party List Representative Franz Castro, it is not a criminal offense to demand aid from the government, as it is the responsibility of the government to provide for assistance to families who are hardly hit by the enhanced community quarantine. This is why the Makabayan bloc lawmakers called for the release of the arrested individuals. For Representative Arlene Brosas of the Gabriela Women's Party List, arresting these individuals will not solve the existing hunger felt by the poor sector. Brosas said people need financial assistance and food, a promise that was made by the government. Bayan Muna Party List Representative Ferdinand Gaite urges the President to hasten the action necessary to bring the promised aid to the public. It was last week when the President has signed into law the Bayanihan to Heal as One Act, giving the Chief Executive special powers to address the COVID-19 crisis in the country. Included in the law is the 275 billion peso fund that is readily available and can be used immediately by the government for its programs like the Social Amelioration Program that will provide 5,000 to 8,000 pesos of financial assistance to poor families. But according to Congressman Gaite of Bayan Muna, a week has passed since the special power was granted to the President, yet there seems to be no urgency in providing aid to the people. According to Congresswoman Brosas, as of March 29, the police were able to arrest 17,309 individuals during the implementation of the enhanced community quarantine. For the Makabayan bloc lawmakers, instead of intensifying security, the President should give priority to giving medical solutions as well as financial assistance and food to poor families who are the most affected by the enhanced community quarantine. Vincent Arboleda, UNTV News and Rescue, Quezon City. We serve the people. We give glory to God.
The number of policemen positive for coronavirus increases to 7. Meanwhile, the Philippine National Police puts up a quarantine area inside its national headquarters. Leia Ilagan reports.
7 police officers have tested positive for COVID-19. PNP spokesperson, Police Brigadier General Bernard Panac says the 4 new cases got infected in the quarantine-controlled area or checkpoint. However, the PNP refuses to divulge the exact checkpoint where the policemen contracted the disease. 3 of them are policemen aged 46 to 53. 1 is a policewoman aged 47. All are assigned in Metro Manila.
Exposure ito sa frontline natin. Part of the risk na ating kinakarap ng mga frontliners natin. And of course, yung possibility na coming from the frontline tapos nag-relieving, so balik sila sa kanilang barracks or sa office, and then yung possible exposure na naman, no? So yung ganon, yung pasa-pasa.
The first 3 cases were recorded in Manila, Laguna, and Pasay. Banac adds that based on the newest data from the PNP Health Service, the number of cops who are considered as patients under investigation has increased to 145, while there are 1,416 policemen considered as persons under monitoring. Because of the increasing number of PUIs and POMs among the police organization, the PNP has put up a quarantine area inside the national headquarters. Banak explains that PNP Chief Police General Archie Gamboa has ordered to use the Kiangan Hall, which has 43 rooms. The first floor will be used by health workers, doctors, nurses, and the medical staff, while the second and third floors will be used by police personnel who need to undergo quarantine. Free food will be served.
PNP Health Service. So sila ang magde-determine kung sino yung bibigyan ng priority. Kasi medyo limited yung number. At umabot na rin ng 1,400 na higit ang PUMs natin.
The PNP chief, for his part, ensures that Camp Crame remains safe because they are exercising safety measures such as the use of decontamination tents and daily disinfection of each building inside the camp. Leia Ilagan, UNTV, News and Rescue. We serve the people, we give glory to God.
The work of the Interagency Task Force for the Management of Emerging Infectious Diseases will continue, although some of its officials are COVID-19 positive. Harley Delgado details why.
Department of the Interior and Local Government, or DILG Secretary Eduardo Año, announced yesterday his COVID-19 test results came out positive. In a statement, Año said the Research Institute for Tropical Medicine informed him of the result yesterday after his test on March 27. According to Año, he started his 14-day quarantine last March 26 after learning that 4 persons he had associated with had tested positive for the coronavirus disease. The secretary calls on all persons he had close contact with to go on self-quarantine and observe any symptoms. He adds he is doing fine and has no symptoms. The secretary will continue his quarantine and will work from home, noting that the result of his test will not dampen his spirit and energy to do his job. Days before Año announced his condition, Armed Forces of the Philippines Chief of Staff General Filimon Santos Jr. tested positive for COVID-19. The AFP chief is in strict quarantine until April 10. Año serves as the vice chairman of the implementing body of the government's National Action Plan, while Santos is a member. Its chairman, Defense Secretary Delfin Lorenzana, has tested negative for the disease, but says he will complete his self-imposed quarantine until April 6. Another member of the implementing body, Philippine National Police Chief Police General Archie Gamboa, has also tested negative for the deadly viral disease, while Department of Social Welfare and Development Secretary Rolando Bautista is also in quarantine. The Interagency Task Force for the Management of Emerging Infectious Diseases assures the government's work will remain unhampered, although some officials are infected.
Nakikita nyo naman na kahit kami sa gobyerno ay hindi po immune dito sa COVID-19. Meron pong may mga matataas na opisyal po na tinamaan na, pero rest assured na tuloy-tuloy pa po ang trabaho ng gobyerno.
Harleen Delgado, UNTV News and Rescue. We serve the people, we give glory to God.
The Department of Public Works and Highways, or DPWH, kicks off the conversion of 3 buildings in Metro Manila into COVID-19 facilities. The DPWH targets to finish the project within 10 days and plans to open one of the auxiliary facilities this week. Joanne Nano tells us why.
The Department of Public Works and Highways, or DPWH, is now fast-tracking the conversion of 3 huge buildings in Metro Manila to be used as COVID-19 facilities. This as the number of confirmed cases in the country continues to spike. Those structures are the Philippine International Convention Center, or PICC, and the World Trade Center in Pasig City and Rizal Memorial Stadium in the city of Manila. These will also be used to isolate positive COVID-19 patients, patients under investigation, and persons under monitoring who are asymptomatic but had exposure to a COVID-19 patient. According to DPWH Secretary Mark Villar, they are targeting to finish the conversion of these health facilities in 10 days. They will work on making one of the 3 structures operational within this week.
Ito po napaka-importante ngayon dahil kailangan matapos sa lalong madaling panahon. So I've given we're giving 10 days, but as early as this week, maging operational na yung isang facility natin. We cannot predict the exact timing of this virus. Of course, this virus dictates to sa timing, but we will be prepared as much as we can.
The DPWH will first convert the PICC Forum Hall, which can accommodate around 630 patients. The DPWH will work together with the private sector to mobilize this project. The DPWH is also ready to use all of its resources to help with the logistics in hospitals nationwide amid the COVID-19 pandemic.
So bukod po sa ginawa namin mga decontamination, marami din kami mga trucks. So yun din ang ino-offer namin sa mga hospital kung kailangan nila ng transport para sa mga, kung meron silang mga supplies na kailangan i-transport, ino-offer po namin. Nagawa na po namin para sa dock center at continuous naman po itong mga services.
Joanano, UNTV News and Rescue. We serve the people, we give glory to God.
The Department of Finance has released the implementing rules and regulations for the mandatory 30-day grace period for all loans as provided for by the Bayanihan to Heal as One law. The covered lending institutions are banks, quasi-banks, non-stock savings and loan associations, credit card issuers, pawn shops, and other credit-granting financial institutions under the supervision of Bangko Sentral ng Pilipinas, Securities and Exchange Commission, Cooperative Development Authority, Government Service Insurance System, Social Security System, and Pag-ibig Fund. No interest penalty, fee, and other charges will be applied to future payment or amortizations of individuals, households, micro, small, and medium enterprises, and corporate borrowers. The initial 30-day grace period shall automatically be extended if the enhanced community quarantine period will be extended. The Philippine Ports Authority, or PPA, warns of possible port shutdown in Manila. According to PPA General Manager J. Santiago, they have been experiencing difficulty with the entry of arriving shipments. Joanano explains why.
The Philippine Ports Authority, or PPA, is urging all importers, consignees, and cargo owners to pull out their overstaying cargoes at the Manila International Container Terminal, or MICT, and Manila South Harbor. According to PPA General Manager J. Santiago, the yard utilization at the MICT and the Manila South Harbor is almost 100% full. This is because majority of the cargoes remain idle after the declaration of enhanced community quarantine in Luzon. The PPA has been experiencing difficulty with the entry of shipments such as medical supplies, medicines, and foods because there are no available spaces for such incoming cargoes. Around 800 refrigerated containers of medical supplies, medicines, and food have been overstaying at the port for more than a month now, according to Santiago. The PPA warns of possible port shutdown in the next 6 days if businessmen fail to withdraw their idle cargoes.
So kung hindi natin mapoproseso yung mga kargamento na nandyan na at nailabas, yung mga barko na parating baka hindi natin sila maproseso dahil walang paglalagyan ng mga kargamento na ibababa ng mga parating na barko.
The PPA is now coordinating with the logistics industry, importers, and consignees to address the problem. Based on the regulations of the PPA and the Bureau of Customs, shipments should be claimed within 30 days from arrival. If they fail to do so, there is a corresponding penalty. Another problem is that importers or consignees just pay the penalty instead of pulling out their shipments. The PPA reiterates that ports are the gateways of the country's commerce and trade, so this should not be taken for granted, especially now that we are in a health crisis due to the COVID-19 pandemic.
Ang maganda na lang sigurong gawin ay magtulong-tulong tayo para ika nga mabawasan natin yung congestion dyan sa pantalan para mapabayaan naman kami sa pamamahala ng mga pantalan na mas maproseso namin na mas marami pang kargamento na kinakailangan ng mga kababayan natin lalo na ngayong panahon ito.
Meanwhile, Meanwhile, the Bureau of Customs confirms the temporary closure of the Manila International Container Terminal or MICT as one of its employees tested positive for coronavirus. The BOC assures a contingency plan to transfer overstaying cargoes to the Port of Manila will be executed to ease congestion amid the MICT's temporary closure. Joan Ano, UNTV News and Rescue. We serve the people, we give glory to God.
Modern science proves the antimicrobial behavior of copper as it was written in the Bible about 5,000 years ago. Asher Kadapan Jr. has these details.
Have you ever thought why copper is being used in some household items like water pipes, doorknobs, or even coins? Did you know why cups made of bronze or brass is commonly used in some countries like India? The book of Exodus in the Bible tells about an instruction of the Lord to Aaron during the time of Moses to make a basin made of brass and to put water in it. It was used for washing Aaron and his sons' hands and feet before entering the tabernacle of the congregation and before approaching the altar so they will not die. But in the modern days, scientists found out about how copper may kill virus and bacteria even in just a few minutes. According to the National Institutes of Health or NIH in the US, the severe acute respiratory syndrome coronavirus 2 or SARS-CoV-2, which causes COVID-19, is detectable in aerosol for up to 3 hours. On cardboard, it takes up to 24 hours, while it may be detectable in both plastic and stainless steel up to 2 to 3 days. But it is noticeable that copper surface can kill the virus just up to 4 hours. According to Michael Schmidt, a professor of microbiology and immunology in the Medical University of South Carolina, components of copper in its alloy, brass and bronze, behave in an antimicrobial action. Electrically charged particles called ions and copper react when a virus is introduced on its surface. Copper destroys the cellular membrane of the virus, including its DNA and RNA components, which are responsible for its mutation. The copper's antimicrobial behavior has already been proved helpful against some epidemic that happened in the last 2 centuries. In the live broadcast of Kuya Daniel Razon's social media channel, KDR-TV, Brother Eli Soriano explains that the discovery of modern science is proof of God's wisdom in the Bible that was already written back in the early centuries of human life on Earth.
Nakita nyo? Ginagawang safe ng Diyos. Kasi yung tabernakulo ng kapisanan, maraming tao ron eh. Pero pagpasok ni Aaron, naglagay sila ng isang tansong hugasan ng paa. Pag pumapasok sila doon, naghugas sila ng tubig na nakalagay doon sa tanso upang sila'y huwag mamatay. Ano ba ito? Sinabi ito basta pag ganun na lang, gaya ng ibang nagbabasa ng Biblia. Hindi po ganun. There is wisdom behind this. Ipinapakita lang sa atin ang mahabang pag-aaral na ginawa ng mga siyentipiko sa ating panahon, natuklasan nila na ang copper ay may antibacterial at antimicrobial property.
This is generally the reason why some doorknobs, faucets, pipes, and even coins that our hands commonly touch are made of copper. But as time goes by and as discoveries are made by modern generation, people diverted to using other materials, especially plastic, which is not effective in the immediate destruction of viruses and even contributes to the pollution of the environment. With the COVID-19 pandemic, some people find ways in preventing the spread of the virus by using items made of copper or covering objects with copper material. In an establishment in Taiwan, doorknobs, handles, and grills, as well as elevator buttons, have been covered with copper foil. Some Filipinos cleverly use copper wires and old 5-centavo coins in making bracelets to ward off viral diseases. Asher Kadapan Jr., UNTV News and Rescue. We serve the people, we give glory to God.
The National Bureau of Investigation Anti-Graft Division served a letter to Pasig City Mayor Vico Sotto this afternoon, asking him to explain the alleged violation of Republic Act No. 11469 or the Bayanihan to Heal as One law. But Mayor Sotto maintains that the city government has been compliant with the national government and did not violate any law. According to Sotto, the letter did not specify the alleged violation and only cited continuous tricycle operations as an example. The mayor explains they complied with the tricycle ban on March 19, while the law was enacted only on March 24. Sotto believes the NBI might have overlooked the date of the law's enactment.
Sana, mag-focus na lang po tayo lahat sa trabaho. Ang dami pa natin kailangan gawin. In fact, when the NBI arrived here, we were in a meeting for the reorganization of our hospital systems here. Tapos maaabala ako, sayang oras ko. Ang dami-dami kong kailangan gawin, ang dami-dami namin kailangan gawin.
The Department of Health warns the public not to patronize rapid testing kits sold online. Meanwhile, the number of confirmed COVID-19 cases in the country rises to 2,311. Vico Miguel reports why.
The Department of Health reported today 227 new confirmed COVID-19 cases in the country, bringing the total to 2,311. The country lost 8 more patients to coronavirus, while 1 more patient recovered from the disease. Because of the continuous surge of cases, medical professionals need additional personal protective equipment, especially the frontliners in COVID-19 referral hospitals. Based on the report of Undersecretary Maria Rosario Vergere, the first batch of 200,000 PPEs for healthcare workers has arrived. The second batch of around 700,000 PPEs will arrive from April 6 to 24.
Ito po ay didiretso sa Office of Civil Defense na siyang tutulong sa pamamahagi sa ating COVID-19 referral hospitals at sa ibang rehiyon. Sa kasalukuyan po, nakapag-procure na po ang kagawaran ng kalusugan ng almost 1 million PPE sets.
Health Secretary Francisco Duque III confirms in a tweet the first shipment has arrived and is now being inspected. 22 hospitals yesterday received their PPE supply from the donations sent to DOH. Referral hospitals have also received more PPE sets. Meanwhile, the DOH warns the public not to patronize rapid testing kits sold online.
Gusto rin po nating ipaalam na ang mga rapid test kits na ito ay hindi binebenta sa publiko. Tanging mga ospital at healthcare workers lamang ang maaring mag-administer nito. Kung kaya't huwag po tayong basta magtitiwala sa mga hindi authorized na mag-aalok ng rapid test kits. Sana po ay wag po kayong bibili ng ganito sa online at ipapagawa kung kani-kanino lang. Ito po pa rin ay gagamitin sa loob ng ospital with the guidance of a doctor.
The Food and Drug Administration has approved 5 rapid or antibody testing kits, and 6 additional more have been approved to date. 49 health facilities and laboratories are now looking to get the approval of DOH as testing facilities for COVID-19. Currently, there are 5 sub-national laboratories authorized to test samples. These are Baguio General Hospital and Medical Center, San Lazaro Hospital, Vicente Sotto Memorial Medical Center, Southern Philippines Medical Center, and UP National Institutes of Health. Yesterday, the Lung Center of the Philippines began testing samples as it received Stage 4 proficiency testing out of the 5-stage accreditation steps of the DOH. Vico Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
The Philippines has recorded a comparably high fatality rate amid the COVID-19 crisis. Some of those have lost to coronavirus are medical professionals, and they number not less than 20. Dante Amento has this story.
There are now more than 870,000 confirmed COVID-19 cases in 180 countries and regions around the world. More than 43,000 have died due to the disease. Some of those the world has lost to coronavirus are medical frontliners. In America, with almost 200,000 confirmed cases, more than 4,000 have lost their lives due to the pandemic, including hundreds of health workers. Italy, with more than 100,000 cases to date, the second highest in the world, 12,000 patients have lost their battle against the disease. More than 60 of them are health workers. In the United Kingdom, 2 doctors who were among the 25,000 who had contracted the disease have died. While in the Philippines, with more than 2,000 confirmed cases as of today, not less than 20 medical professionals have died after contracting the virus from patients they were trying to help survive the respiratory disease. This number is high compared with that in countries with a 6-digit count, such as the USA and Spain. The Philippine Medical Association says that aside from overwhelming numbers of patients in healthcare facilities, there are PUIs and PUMs who did not disclose their travel and exposure histories. The possibility is that those persons did not observe the health department's quarantine protocols, leading to the transmission of the coronavirus even to medical professionals. Even the lack of personal protective equipment is a huge factor in the problem.
Nanawagan din kami na tulungan din kami, no? Na lalo po yung ating mga suppliers ng mga PPE. Kailangan po namin kayo, no? Ito ngayon ang pagkakataon para kayo makatulong, no? Of course, hindi naman natin kayo iba donation.
Meanwhile, the IATF against COVID-19 says that supplies have already arrived and for distribution through the Department of Health.
The Department of Health has announced that it has procured 1 million sets of personal protective equipment or PPEs for our health workers. The first tranche of deliveries arrived last night.
Dante Amento, UNTV, News and Rescue, Quezon City. We serve the people, we give glory to God.
And for the news abroad, here's Kath Dumaraos live from Bangkok, Thailand. Kath, good evening.
Good evening, Diego. A doctor who gave Russian President Vladimir Putin a tour of Moscow's main coronavirus hospital last week said on Tuesday he had himself been diagnosed with the virus. Putin visited the Komunarka hospital last Tuesday where he chatted to the doctor Denis Protsenko. Neither man was wearing protective equipment during their conversation, TV footage from the visit showed. The Kremlin said that Putin was being regularly tested for coronavirus and that everything is okay, the RIA news agency reported. It has previously said that Putin is being protected from viruses and other illnesses around the clock. A French church gathering sparks country's biggest coronavirus cluster. Meanwhile, a 12-year-old girl has died in Belgium after testing positive for COVID-19, making her Europe's youngest known victim. Details in this report.
In Belgium, a 12-year-old girl died in Belgium of the coronavirus, a spokesman for the Belgian government's dedicated task force said on Tuesday. Virologist Emmanuel Andre said that such occurrence was rare. The officials did not provide details on whether or not she had any previous medical conditions at the time. Overall, Belgium's death toll rose by 98 to a total of 705 people on Tuesday. The country reported 876 new cases of COVID-19, bringing the total number of confirmed infections to 12,775. In France, around 2,500 confirmed cases of the coronavirus have been linked to one prayer meeting in the French city of Mulhouse, contributing to the country's biggest COVID-19 cluster. Worshippers who became infected during the meeting at the Evangelical Superchurch Christian Open Door on February 18 unwittingly carried the disease far and wide to Burkina Faso, French Guiana, Corsica, and Switzerland. The meeting star preacher Mamadou Karambiri and his wife tested positive for the virus on March 1st back in Ouagadougou in Burkina Faso. Church leaders said 17 people who caught coronavirus at the gathering have since died. Mulhouse in France's east has been hit hard by the outbreak, with the military setting up a temporary field hospital to accommodate 30 patients in critical condition. And in the USA, a soccer stadium parking lot in downtown Las Vegas, Nevada has been set up as a temporary place to sleep for homeless people, allowing them to observe social distancing guidelines amid the coronavirus outbreak. White lines on the asphalt mark spots where people can set up their sleeping pads and blankets at a safe distance from others. According to local media, a local shelter temporarily closed its doors, leaving hundreds of people without a place to sleep. Kat Dumaraos, UNTV News and Rescue. We serve the people, we give glory to God.
A breathing aid that can help keep coronavirus patients out of intensive care has been created in under a week. The device, called Continuous Positive Airway Pressure or CPAP devices, delivers oxygen to the lungs without needing a ventilator. Jovic Burmas has this story.
A new version of a breathing aid that can help coronavirus patients has been developed in less than a week by a team involving Mercedes Formula One and is being trialed at London hospitals. Continuous positive airway pressure or CPAP devices have been used in China and Italy to deliver air and oxygen under pressure to patients' lungs to help them breathe without the need for them to go on a ventilator, a more invasive process. 40 of the new devices have been delivered to UCLH and to 3 other London hospitals. If trials go well, up to 1,000 of the CPAP machines can be produced per day by Mercedes-AMG-HPP beginning in a week's time.
In the next few days, they will be delivering a further 100 to us, and this is a capacity to deliver 1,000 a day within a reasonable timescale.
Asked about the risk to healthcare workers of using CPAPs as contaminated droplets can escape from the device, Professor Rebecca Shipley said that the risks were very low if those workers wore appropriate personal protective equipment. Reports from Italy indicate that approximately 50% of patients given CPAP have avoided the need for invasive mechanical ventilation, which involves patients being sedated, freeing up ventilators for those more in need. UCLH critical care consultant Professor Mervyn Singer hopes it will make a real difference in hospitals.
I sincerely think it may actually save many lives by preventing patients from needing to go onto a ventilator and again saving that vital resource for the very, very severely ill.
Britain announced separately on Monday that it has placed an order for 10,000 ventilators to be made by a consortium of companies including Ford, Airbus and Rolls-Royce as part of efforts to fight the coronavirus. Jovic Burmas, UNTV News and Rescue. We serve the people, we give glory to God.
And those are the stories from around the globe. Back to you, Diego.
Thank you, Catherine Moraos, reporting live from Bangkok, Thailand.
A frontliner shares how his father, a policeman, braves the everyday threat of the coronavirus disease. For Alodia Manuzon, there is a more powerful tool to fight the invisible enemy aside from staying at home. Let's watch this.
Have you ever wondered on what's the mindset of our frontliners today? Many of them just simply do what they were called to do. They know the significance of the duties they need to fulfill. They are cognizant of the risks, but they simply choose not to say anything. These are silent fears that may not be obvious, but to a loved one, these are felt deep. In silence, both anxieties and bravery they exhibit. To a daughter, these are not hidden. She'd like to tell the world of this bravery and utter patriotism of a father who is called to a duty.
So my father is currently a police staff sergeant at NCRPO, and he was ordered to render duty at Frontline, inspecting every checkpoints around Metro Manila. And amidst the novel coronavirus widespread, they are still compromising their own health just to ensure us.
Her father, being a policeman, the chief tool used for his duty is a gun. Today, guns and bullets shall not protect his father, nor the constituents he serves. The fight today is against the virus, an invisible but very strong foe.
Tulungan tayo dahil yung laban na ito, hindi ito katulad ng mga previous na nangyari sa ating bansa na kailangan ng baril at saka ng bala para mapatay yung kalaban, dahil yung kalaban natin ngayon, isa siyang sakit na lumalaganap sa ating bansa.
Many times over, we were asked to stay home. This daughter asked for something more from us.
yung panalangin, yung dasal at yung suporta natin para sa kanila. Sana ay manatili na lang po tayo sa ating bahay dahil yun lang din po yung maitutulong natin sa kanila para hindi na po lumaganap yung pandemic na nangyayari ngayon sa ating bansa.
How this daughter loved her father is simply touching. Would you have done the same? The sacrifices of frontliners like Jover Manuzon, do they mean anything for you?
Our kasangbahay, we are at a time when the country is under a state of health emergency. The cooperation of all Filipinos is imperative to avoid the deadly virus. We are calling on everyone to be calm.
And most importantly, let us join together in prayer for our country and for the whole world to survive this crisis. You may join us in our daily UNTV community prayer like this one that you are seeing on your television screen. And those are the reasons behind the news. I am William Theo. We serve the people. We give glory to God.